literally destroy a huge percentage of a drug before it ever even reaches the rest of your body. It's like a mandatory toll booth that takes a huge chunk of your cargo.
And that is why some drugs have to be injected. You're basically creating a detour to bypass the gut and the liver's first-pass toll booth completely. A classic example is lidocaine. If you were to swallow lidocaine, more than 60% of it would be completely wiped out by the liver on that first pass, making it almost useless. By injecting it, the drug gets to work right away, totally avoiding that toll booth.
But believe it or not, there's one place in the body with even tighter security: the brain. It's protected by something called the blood-brain barrier, or the BBB. And this is like a super tightly knit wall of cells that is incredibly picky about what it lets through. This is great for protecting our most important organ, but it also makes it unbelievably difficult to get drugs into the brain to treat things like neurological conditions.
So, against all odds, our drug has survived the whole journey and it's reached the right neighborhood in the body. Now for the final, most critical step. It has to interact with its target receptor to actually do its job. It's time for the molecular handshake. You know, for the longest time, we thought of this interaction like a rigid key fitting perfectly into a rigid lock, but we now know it's so much more dynamic than that. The modern view is what we call a flexible fit. As the drug gets close to the receptor, both molecules can actually change their shape a little bit to create the perfect bond. It's less like a key in a lock and more like two hands clasping together perfectly.
All right, mission accomplished. The drug has done its job. But it can't just hang around forever, right? The body has to clean up shop and get rid of it. And this is the final stage of its life cycle: metabolism and excretion.
So how do they leave? Well, the main exit route is through the kidneys, where the drugs and what's left of them are filtered from the blood into your urine. But they can also be eliminated through feces and, this is really important, they can be passed into the milk of nursing mothers, which is obviously a critical thing to consider for new moms.
But, some drugs are stragglers. They don't leave right away. The really fat-soluble drugs, like the anesthetic thiopental, can actually hide out in your body fat. Others, like a drug called Suramin, can bind so tightly to proteins in your blood that they create this reservoir that releases the drug super slowly over time. In fact, Suramin can hang out in your body for up to 3 months. It's incredible.
So, from a simple pill to a journey through a chemical war zone, past elite gatekeepers, all the way to a final molecular handshake, it's just an amazing process. And it really makes you wonder, right? As we get better and better at mapping this inner world of our bodies, will the next generation of drug heroes be less like scattershot pills and more like microscopic guided missiles, designed to complete their mission with absolute precision and zero collateral damage? What a thought.